Every once in a while on social media, I'll see a story pop up about how dangerous chiropractors are. It gets a ton of comments, it gets a ton of interaction, and it usually follows one person who was injured at a chiropractor's office, and it goes on to frame the whole story around that about how dangerous chiropractors are. And like I said, it gets a ton of engagement, people arguing in the comments about whether or not they are safe, they aren't safe. Obviously, everybody has their biases, but today I'm going to explain you and prove to you why chiropractic actually is safe. What I think is happening in these stories, because these are stories about real people, things that did happen. So what's going on there? Why are these things happening? And the third thing I'm going to talk about is what I think the real damage of these type of stories are and what we could do about it. So the first way that I'm going to prove to you that chiropractic actually isn't dangerous and it's a very, very safe treatment is we're going to use malpractice insurance, because we could argue about studies all the time. You've seen this endlessly. People argue about whose study's right and whose isn't. What I'm going to do is I'm going to use insurance companies because they make money and they don't care about who's right or wrong. They just care about making money. So the way malpractice insurance works is if a doctor injures a patient and they get sued, the malpractice insurance will cover that. And they make money the same way every insurance company makes money. So your car insurance makes money by charging the correct premiums. So a teenager is going to pay a higher premium than somebody who's been driving for a long time. The reason for that is because they're more likely to get in an accident and the insurance company is more likely to have a payout. So they have to pay more money into the insurance. If they didn't, the insurance company would not be feasible. It doesn't work that way. Or if somebody's been in accidents before, they're more likely to get in another accident. So their insurance rates go up. That's how these companies make money. So malpractice insurance works exactly the same way. So for the more risky professions, they have to pay much more going into their policies because it's much more likely that they're going to have to get a payout. So if we look at the rates of malpractice insurance, they should make sense where more dangerous professions, more dangerous specialties are paying higher malpractice insurance. So let's take a look at some of the averages. It varies state by state. I'm giving you a ballpark number of what these people pay. Don't kill me if they're not exactly right. So malpractice insurance for surgeons, depending on the type of surgeon they are, range from about $40,000 to $100,000 a year. So they're paying a ton every year in malpractice insurance. This makes sense because they're doing very risky treatments. There's a lot that can go wrong in a surgery. If they do have something go wrong with the surgery, it's usually a very big, dramatic, negative outcome. So they're going to be big payouts. So it makes sense that they're expensive. OBGYNs pay an average of $40,000 or more. This makes sense too because you have to think they're doing labor and delivery as well. If something happens while delivering a baby, this is a huge settlement. It's costing the insurance company a ton of money. It makes sense that their malpractice costs will be very high. Pain management doctors, they're paying $15,000 to $30,000 per year. A psychiatrist, they're paying about $10,000 a year. Now, you might not think a psychiatrist, like, why would they even have to have malpractice insurance? They're talking to people. But remember, we're not talking about psychologists, we're talking about psychiatrists. So anytime you're dealing with medication, that's going to increase the risk to your patients. So they're prescribing meds. Their malpractice insurance is around $10,000 a year. Your family doctor is going to pay around $15,000 a year. Let's bring it down to less risky professions, like your dentist. A dentist is $2,500 a year they're paying for malpractice insurance. Now, most people might be afraid to go to the dentist just because they don't like it, but you're not afraid to go to the doctor because you're not afraid to go to the dentist because you're afraid that you're about to get injured or you're going to have some life-altering permanent damage done to you, right? They're paying $2,500 a year because it's very, very low risk treatments, very low risk procedures. Where do chiropractors rank on this? Chiropractors are paying anywhere from $500 to $3,000 per year. I pay a little bit less than $2,000 per year. So in most cases, I'm paying less malpractice insurance than your dentist. So where does that lead? Where does that leave us? Well, there's only two possible conclusions. One, the insurance companies decided that they were going to do chiropractors a favor and they just decided to lose money for us so that our insurance didn't cost so high. Or two, we actually aren't causing all of these injuries that people think we are. And it's actually a very, very safe type of treatment. And according to the numbers, we're as safe or safer than than going to your dentist. And you can argue with me all you want about the studies or um, the anecdotes or the stories you read online, but insurance companies are there to make money and they're not going to lose money on us if we're causing all of these injuries. We're not going to have such low rates if it's such a dangerous thing like people are saying it is. And over again, not just in these comments, I'll have patients come to me defying their doctor's orders, telling them that they should never go to a chiropractor. Neurosurgeons telling their patients that they should opt for surgery instead of going to the chiropractor, which is insane to me because it's such a safe treatment and it can help so many people. All right, so beyond that, what is happening with these stories? And these are real stories, they're following real people. What's going on with them? Well, these stories are usually highlighting a type of stroke called a vertebral artery dissection. Now, what's happening here, and I believe what's happening, and I think all of the evidence kind of backs me up on this, is that these people were about to have a stroke, and the movement during a neck adjustment is what set it off. Why do I think that? Well, here's a video of me doing a neck adjustment. Look how much movement there is. Look how much force is being used. It's very little. People in these stories are usually young people, and how are they getting through their lives without moving their neck that much? Are you suggesting that a young, healthy artery in a patient can be torn in half from that much movement, that much force? I just don't believe it. I don't buy it. On its face, it doesn't make sense. But and if what I'm saying is true, that person was about to have a stroke and this extra movement is the thing that set it off, then we should be able to see that in other settings. And indeed, we do see that in other settings. There's a thing called hairdresser syndrome, where people have their head back over the sink getting their hair washed, and that causes a vertebral artery dissection. That doesn't make people afraid to go to a hairdresser. Why? Because that person didn't get a stroke because they put their neck back over the sink to get their hair washed. They had a stroke because they were about to have a stroke, and that may be the thing that pushed it over the edge, but it wasn't something that was never going to happen to them if they didn't go to get their hair washed, right? Like that's not a realistic thing. Or this is also something that happens when people go to the dentist and have an extended procedure. It's not that the dentist did anything to cause that stroke, but they may have had them bent back and have their neck in a position that triggered that stroke to happen right now. But again, this is not something that was never going to happen in these people. So it is unfortunate, and I understand that people, they may have attributed to the chiropractor or attributed to the adjustment, but that's just not what's happening. What's happening is these people were on the verge of having a stroke, and this is the thing that put them over the top. And even if you just Google risk of vertebral artery dissection, rotation of the head is listed as one of the possible things that can set it off. So just simple rotation of the head, people look up over their shoulder and it triggers it. So it's, like I said, traumatic. It's horribly unfortunate for the people that it happened to, but it is very important to clarify why it's happening, and that it's not happening because they went and got their neck adjusted. This brings me to my third point. What the damages of these stories are is that it scares people away from a very safe treatment into one that is less safe. So if you scare somebody away from going to a chiropractor, and let's say they don't even go get a different treatment, they just don't get treatment for their neck pain, they just let it go on. They say it's not bad enough to take this risk. Well, eventually that pain does get bad enough. If they don't solve that problem, if they don't correct that issue, at some point they're going to need treatment for it. So they escalate the treatment to something more dangerous. They get steroid injections, or they start to develop arthritis. The condition progresses, and eventually maybe they end up on the surgery table. So because that person was scared of a risk that is virtually non-existent, they end up being forced down a path that led them to a procedure that is much, 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 much more dangerous for them, right? And I get why people do that, because they don't understand that these risks are so low of going to a chiropractor, partly why I'm making this video. But what's frustrating is that when I hear doctors who know better telling people this stuff, right? When I have a neurosurgeon telling a patient that they shouldn't go to a chiropractor because it's too dangerous, and then in the same breath set them up for a neck surgery to fuse their spine together, that's insane. It doesn't make sense. It's not correct. And it's really a shame that people are being scared away from safe options that can really help them in favor of more risky procedures. And for me personally, I consider a more risky procedure just taking Advil or taking ibuprofen. And the reason I consider those more dangerous than going to a chiropractor is they're not fixing the problem. It's more dangerous because it's allowing the problem you have to progress, and instead of addressing it, you're using a painkiller to mask or put a Band-Aid on that problem and not actually getting the help that you need or deserve. So I'm hoping that if you had any questions about chiropractic, if you were scared about it, if you had any apprehension of getting treatment because of one of these stories, that this helped clear up some of that misinformation for you. And hopefully it made you feel a little bit better about making that decision to go see the chiropractor.